This is Amanda Brummett with the Working Well and Coppell Committee of the Coppell Chamber of Commerce. I'm here today with Dr. Javvaji. She's a board-certified internist and geriatrician. Thanks for being here, Dr. Javvaji.
Thank you for having me, Amanda.
Absolutely. So I have a few questions for you today, both about overall health, but more geared towards overall health in this new world we're living in with COVID-19. And the first one is, what are you doing to set your team up for good overall health right now, both physically and mentally?
Yes, like you said, COVID-19 has changed the way of life for all of us right now. And right now, the way I'm setting up my office is we are currently working from home because, as you might know, I am, like I said, board-certified geriatrician, but I deal with 65 and above who are the most vulnerable people in COVID-19, and I don't want to expose them to any pathogens that might be out there, and having a waiting room full of people who could be asymptomatic with COVID and still spread the disease is definitely a concern for me. So we are trying to limit the exposure as much as possible and trying to do video telemedicine and just phone calls if they don't have access to video, and trying the best to coordinate help. You know, if they are well and I think they might have like strep throat or something else going on, they are coming into the office where they're getting swabbed and blood work, just minor things that can be done in a clinic, but, you know, just very spaced out where you're not exposed to a group of people, you know, that could potentially have the disease. And also the way I'm staying safe, I have a newborn at home, so I am trying to limit my exposure as well because we don't know much about the disease and how it'll affect an infant. And so I'm trying to protect my family and also protect my patients in this new era.
Right. Awesome. So yeah, I had a chance to visit with you earlier this week, and you always seemed like you have such a good outlook and a smile on your face. So considering all the scary things going on, what's keeping that smile on your face?
Oh, I just love what I do in general. And, you know, with anything, you just want to take your precautions and be a step ahead. And as long as we are doing what we need to do and, you know, stay within our limits and follow the guidelines, I think this is the best we can do in this situation. And yeah, so the smile on my face never goes away. It's going to be permanent unless something unusual happens, but you know, I'm going to try my best to be as positive as I can with my patients and the outlook and all of this. And you know, it whatever it is, we can get through this. And it might take a lot longer than we anticipated, but you know, that with modern technology, we can definitely overcome that hurdle too as well. And there's no limit to what healthcare can do, especially in this day and age. And yeah, so I'm just optimistic about what we can do and what we weren't able to do if this were to happen 10 years ago. But, you know, we're in an age where we can reach the people that weren't able to access a physician. We're able to, you know, provide care almost virtually. And now I'm implementing this new thing in my office where I'm going to give my patients, especially the ones that are suffering from hypertension and diabetes and more chronic conditions, I am trying to give them a home monitor with blood pressure and a glucose monitor and things like that. So that way I can keep track of them and they can keep track of their health in the midst of all of this. And we are trying to implement that as a telehealth way of monitoring all of this. And I'm also, for my asthmatics, and because of how scary it is, I'm also implementing, trying to get access to pulse oximeters. And so that way they can monitor their pulse ox. You know, if it's dropping too low, that's your sign to go get help. And it's time to go visit the ER or hospital and get yourself checked up. Otherwise, it's stay at home, stay safe, treat it like it's the flu with lots of fluids and hydration. And but I feel like these tools are helping me kind of keep a close eye on the most vulnerable of patients.
Yeah, that makes sense. So as an internist, and even more so as a geriatrician, I know that prevention is really, really important for you and for the specialty as a whole. So if there was something that you could tell people and they would actually listen to you and absolutely do it, what would that be related to prevention?
Honestly, I wish it could be more, but a simple walk outside, honestly, is doing wonders for mental health and for physical health. You know, you're going, obviously, maintain the 6 foot distance with this
Mhm.
whole guidelines, but going out and getting the breath of fresh air, especially as the weather improves, minus the Texas allergies. Um, it is, I feel like, one of the best things you could do for your body with the sunlight and just, you know, walking around with the different kind of senses that are going on, your smell, your taste. Um, just, you're not tasting anything, you're,
Depends on
your
how bad the
smell,
allergies
your
are.
sight, and just getting the blood flowing as you're walking, I feel like is the best thing you could do for your body. And it's so simple. And as you age, studies over and over and over again have shown that exercise beats medication, exercise beats so and so. And in general, it just gets the blood flowing to all your organs. And I feel like it really does make a huge impact in one's life. And obviously diet control and all that too added to it. But if I could pick just one thing, it would be exercise.
I love that. Exercise free. It's plentiful. It's fairly easy to do. So,
Yes, it is, and now it's still allowed.
right. Yes.
um, so as long as you're maintaining your distance, it's still allowed. So yes, I encourage it more than ever now.
Okay. Fabulous. So,
Cabin fever.
pardon, go ahead.
I said just so you don't have cabin fever either.
Yes. Absolutely. Well, I know that once all this clears, that you and I are going to sit down again and talk more about wellness and prevention. So the chamber members will get to hear more then. But in between now and then, how do patients find you? What's the process for new patients? Can you kind of give us some information for the people that don't want to?
So yes, so I'm still currently seeing new patients. If I feel like you are well enough to come into the office, we are just taking a set of vitals, just entering you into our system, drawing any blood work just to get you established, and we're doing that protocol. But if you feel like you are sick and you might have symptoms that are respiratory in nature and that can potentially be spread to people, you know, we are doing just a quick telemedicine over the phone. We'll just gather your information and do a virtual visit until you're well enough to, you know, be seen. The whole thing with COVID-19, I just wanted to stress too, is, you know, they recommend the 14-day quarantine because it takes 7 days for the virus to incubate and then 7 days for the symptoms to resolve.
Mhm.
And so that's why they're recommending the 14-day length. You know, once it gets into your system and as the 7 days go by, you need to be at least 3 days without fever, 3 days without, you know, without fever, without any medications to help reduce it, and 7 days from the onset of symptoms, and you are okay to leave your home then. So I would be more than willing to see you acutely, and then, you know, as soon as you get better, I can follow up and also arrange for a visit just to make sure you're healing as you should and things are going as you should though. But I am still open. We are open from 9 to 4 every day. I am, you know, since it's telemedicine, I usually don't work on Fridays, but now I'm opening Fridays up too, just so my patients have access during this time. And obviously, mine can call it at any time, and we'll be more than happy to help them. And I have a wonderful MA who is more than happy to, you know, schedule a visit and answer any questions you might have even before your visit. And yeah, I'd be happy to see any new and accepting all Medicare, which I know has become an issue recently. I do take insurances and I do take new Medicare and Medicare patients. And so yeah, just give our office a call and you can schedule a visit.
Fabulous. Well, I know how busy you are during this time, so thank you for making time to do this. And I look forward to catching up with you again when things calm down and
Yes, of
getting some
course.
more information about how you're working well in Coppell.
Thank you so much for having me. And yes, spread the info.